And I called and made my appointment and tried to explain to them what I had, and I needed to speak to a oncologist and a surgeon. Well, the conversation with the doctor was pretty much what I thought. Oh, I don't know. I've never had surgery. I've never done a surgery for mesothelioma. My first operation would be to go in, cut out all the disease I can find, and put in a little shunt in your stomach so we can administer chemotherapy directly to the areas that are affected. And I said, well, what else after that? And he says, oh, well, we just wait and see how it goes for the first 6 months. And I said to him, I said, well, frankly, that's not good enough. I need something more aggressive. This disease directly, specifically said aggressive. And it's on its own terms and it's driving. So I had to stop it from driving and allow me to drive. So I asked him to go online for me and look to see if there was any research going on or anything that was out there that was open in places and areas that knew this disease, that walked this disease, that knew this disease. I need professional help. And that's what he did. He went online, and he's also associated with WashU, and they're also associated with NIH in Baltimore. And they have their own little, like, cross directories of research of different things that are going on. And he called me 2 days later and said he had found me some research that was going on at the NIH. And I said, okay, well, who do I need to talk to? Give me their phone number and name, and I'll call them. We need to get going on this. And that's what I did. I called the NIH. The first thing they told me is that they needed to get in touch with the doctors, and they needed to get my biopsies and my scans, and they needed to take a look at it to see if I was a candidate. I called the doctor and told them what I needed for them to send it to the NIH. And they got all that together in about a week, and they sent it all up to them. And they also sent them blood workup and everything that I had done previously with DePaul Hospital. Well, the NIH, as far as them getting back in touch with me, was a very long period. It was kind of waiting for that root canal to happen. You knew there was going to be pain, but you didn't know when it was going to occur. So you waited and you waited, and they read the scans, they looked at the biopsies, and they looked at everything. It took them about 6 weeks. And when they did call, and they said, well, we're confirming that you do have mesothelioma, because when they sent it out to get it confirmed, it was 2 to 1. 2 said I didn't have meso and 1 said I did. So that was a little bit scary, because you didn't know what you had. You still weren't sure. But they confirmed it, and they said, we will be able to help you. And that made my day, because by then it was June. And I was getting fatter and bigger with fluid and had to have some relief. So I said, thank you, Lord. This is what I needed to hear.